All right. Hello, everyone. We are at 2 o'clock, so we will go on ahead and get started. My name is Dr. Tina Lewandowski, and I'm the Director of Engagement here at the ADRC. I'd like to thank you for attending. Today, we have a presentation from Kelly G. Loeb about her new role here at the ADRC, and she's going to talk a little bit about Loeb on brain lobes. We also want to share a little bit about Kelly with you. Kelly G. Loeb is our community engagement coordinator for the KU Alzheimer's Disease Research Center, where she will be providing education, resources, and support in both English and Spanish for people with Alzheimer's disease, their family, professional caregivers, healthcare providers, and the general public. Kelly has a master's degree in social work from the University of Kansas, and her bachelor's degree is in English from the University of Missouri. And that means Kelly loves both sides of that state line. However, she will still always call Los Angeles, California home. She is a member of the Community Leaders Board for the Alzheimer's Association Heart of America chapter. Kelly also facilitates a support group, which she created in 2002, focusing on Black families in Kansas City's urban core for caregivers of people with Alzheimer's disease and other dementias. Additionally, Kelly is a 2002 alumna of the inaugural cohort of the American Society on Aging Rise Fellowship for Black, Indigenous, and other people of color who are leaders in the field of aging. Since 2011, Kelly G has also been a SHIP State Health Insurance Assistance Program counselor and educator, guiding Medicare beneficiaries impartially in choosing and using health insurance options that give them the most cost-effective, comprehensive, and convenient coverage. She thrives on ensuring beneficiaries and their communities use and understanding of their healthcare systems. Enthusiastic, educational, and effective describe Kelly's public speaking style, and she enjoys sharing her professional expertise and personal panache with audiences of any size. One favorite speaking engagement was Kelly's message to eager Kansas Cityans after she was chosen as Miss Juneteenth KC 2021 in recognition of her community service and care. Kelly works towards a world with health equity in which all have affordable, comprehensive, compassionate, and quality healthcare, and Alzheimer's disease is just a memory. Kelly, thanks so much for joining us today. Everyone, just a friendly reminder, please keep your microphones on mute. And if you have any questions during or after the presentation, you may type them in the chat, and we will leave time for Kelly to answer questions at the end of her presentation. And as always, we will have our recording available on our website within 24 hours. Kelly G, thanks again, and I will go on ahead and turn it over to you.
Wow, thank you so much, Tina, and thank you, everybody. As Tina was reading about me, I was scrolling through the list of participants, and I'm so excited that you all chose this time to be with me, and I am more than excited to be part of the KU Alzheimer's Disease Research Center and to be sort of your captain as you interact with the ADRC. You'll notice if you're looking at the screen that there is a photo of a cruise ship on screen, and I thought as a way to frame our conversation for today that we could take a fantastic voyage to January in Kansas City. I assume most of you are in Kansas City, which means it's not really ideal cruising weather, but we could imagine, we could dream that we were on a wonderful cruise ship and the sun is shining and the waves are gently lapping, and it's whatever temperature feels best for you. As a Californian, for me, that's about 80 degrees. And sunny, and there's no COVID on this cruise. You can eat as much as you want. You don't have to pay. It's really perfect. And we're going to talk about ways that the ADRC can be supportive to you wherever you are in any journey that's connected with Alzheimer's or another dementia. So with that said, our sail date is today, Thursday, January 19th. You are on the KU Alzheimer's Disease Research Center cruise line. It is a luxury cruise where all of the amenities will be provided for you. And we will embark from our office on Shawnee Mission Parkway or from wherever you happen to be. You can choose to put your life jacket on or not. This is going to be a very safe cruise, I promise. And we will disembark later with lots of good information. As Tina said, please feel free to use the chat if you have a question or a comment. In my time being an educator about Alzheimer's disease, it has become very clear to me that when you get something on your mind, sometimes you just have to get it out before it gets away from you. So Tina said we could have questions at the end, but please feel free to use the chat to say whatever you need to say, and I think she'll help me monitor that, and we will go forward. But with that, I'm going to go to my next slide, next part of our cruise here. I think I am. There we go. So ahoy, mates. I meant to wear my captain's hat today, but I was so excited about getting here today. I left it in the car, so I don't have my official captain hat on, but I will salute you all and invite you to check out our cruise itinerary on the wheel to the right there. We've got some ports of call to visit where we'll talk a bit about the programs and services that the ADRC offers that include family and community education support. We'll talk about how you can get involved in clinical trials. You already know about the weekly webinar because you are here with us today, and I hope you will join us every Thursday as you can. And the brain boosters, we'll talk a bit about support groups, the LEAP program, and we can probably wrap up our ports of call visits with talking about some shore excursions that include MyAlliance, which I think you all know about because many of you probably got the email with the link for today. And we'll talk about the Care Text and Quita Text programs. And then as we disembark by 2:30, fastest cruise ever, we will talk about some supports and souvenirs that I and my colleagues at the ADRC can offer you. So with that, we'll break the bottle of champagne on the ship and we will set sail. And I presume that many of you know about a lot of the programs and services that the ADRC offers. And I hope you're using them. I hope you're getting lots of good support and resources and education. If you don't know about them, you're in luck. You're in the right place because we're going to talk about those. The ADRC, the Alzheimer's Disease Research Center, is one of 33 designated centers in the United States. So however it is you ended up living in Kansas City, if that's in fact where you live, we were really very clever to do that because in 50 states, we've got 33 ADRCs and Kansas City is lucky enough to have one. And since Kansas City is one of those cool places that is on a state line, whether you live in Kansas or Missouri, you can have access to all the really great programs and services that the ADRC offers. The mission and the vision of the ADRC, of course, is prevention about Alzheimer's disease, education, research into methods that will intervene to stop or slow down the progression of the disease. And ultimately, as you heard in my bio, we would like to make Alzheimer's disease just a memory. If you're quick with math, you may have noticed in Tina's introduction of me that I've been working in the Alzheimer's sphere for about 20 years. It was my very first job right out of college. So in the summer of 2001, I was an intern at the Alzheimer's Association, and then I started working there. And I'll let y'all in on a little secret. I might be the captain of this cruise. I am the captain of this cruise. And 20 years later, I've had a long history of knowing about Alzheimer's disease. But in 2001, when I was 25 years old, I didn't know much about Alzheimer's disease at all, but I was willing to learn. And the Alzheimer's Association was willing to take a chance on me. And it became something that ended up being both very professionally and personally meaningful for me, and I'm so proud to be now part of the KUADRC. And I have certainly learned so much about Alzheimer's disease along the way, learn something new every day, and some of my greatest teachers have been people like you who ask questions and need resources and share your journeys and share your experiences. So I'm so grateful for all of those things and so grateful to take the information that I've learned over my career and distill it back to our community so that you can feel well scaffolded by this program and so many others that we offer. So the ADRC is meant to support a person with a diagnosis, whether it's Alzheimer's disease or Lewy body dementia, frontotemporal disease, one of the more than 70 different kinds of dementias that we have identified. If you have questions about that, You need to talk with a healthcare professional. You need to talk with a social worker, a nurse, a researcher about what might be a good plan for coming up with some support for you. And the ADRC really is a great place to do that. And we have lots of family and education services, not only for the person who has a diagnosis, but as you no doubt know already, Alzheimer's disease is a diagnosis that affects the whole family, not just the person with a diagnosis. And so there are lots of really great programs involved at the ADRC, and this is such a great way for you to know about that. One of the most important things at the ADRC is right in the name. It's the Alzheimer's Disease Research Center. And so there are lots of clinical trials happening that will look at why Alzheimer's disease happens the way it does, what kinds of things we can do to intervene to slow down or stop the progress, and what we can do in the future to keep Alzheimer's disease at bay. Some of the research projects include looking at exercise and other physical activity. Some of them look at nutrition. I think those might be some of my favorites. I was over on a tour today with my colleague Amy, and I think Amy's on the meeting here, so hi Amy. We were on a tour today over in the clinical offices of the ADRC, and we were lucky enough to peek into a demonstration kitchen where they were making food. Now, I'm not going to tell you that that meal is the answer, the cure to Alzheimer's disease, but it's very exciting to think about clinical trials that are leading us that way, which reminds me of our LEAP program. I'll come back to that and talk about the Mediterranean diet class that they are presenting here in just a moment. But clinical trials, again, are so important. Research studies are so meaningful for so many reasons, for people who currently have a diagnosis, for people who have a family history of the diagnosis, even for just your John Doe on the street who's concerned about memory loss, who's concerned about what happens as we all are getting older. Participating in a clinical trial is so meaningful and so special and benefits us individually, benefits families, benefits your fellow humans as it gets us all closer to figuring out what this disease looks like and how we can stop it. And I can't not say that clinical trials are particularly important for populations that have been traditionally missed by research. And that's something that is especially meaningful to me. Both of my grandmothers had Alzheimer's disease, and they have since passed on. I like to think of them kind of guiding me as I work in their honor and their memory. And so I'm especially interested in knowing what that might mean for my immediate family and for the future. I grew up the daughter of healthcare professionals, and so I always have been kind of engaged in knowing how important it is to participate in clinical trials and how important our good health is. But I also recognize that many people in my community and other underserved communities have not always had access to or awareness of or reasons to even trust participating in clinical trials. And I want to say out of my own mouth, and some of you don't know me, but I promise you can trust me, that the ADRC is absolutely a safe place, a trustworthy place, a place that's doing really strong, meaningful clinical research that is meant to move us all toward a world in which Alzheimer's disease is just a memory. And those are some things that we will talk about as the weekly webinars continue in 2023. We will have a whole year's worth every week of people doing some really exciting thinking about Alzheimer's disease research and education. I'm super excited to meet some of the folks we've got lined up to be speakers and to find some new speakers. I think about who I was 20 years ago, and all I knew about Alzheimer's disease was maybe what you might see on TV or in a movie. And now I feel quite well educated and quite hopeful about even more learning that I am going to be able to do as part of this great organization. So stay tuned. We will continue to do those things in the webinars every Thursday, and you'll get the announcement on Monday in the MyAlliance newsletter. And you will also be able to follow us on social media. I believe, hot off the presses, maybe in the last week or so, the KU ADRC is now on Instagram, everyone. So you can join the cool kids. I know we're on Facebook also. I think our Instagram page is pretty new, and maybe Tina could put it in the chat. Our Instagram username, I think that's what you call it, is KUADRC. So it's pretty easy to remember. And you can go there and get all kinds of announcements about research trials and the weekly webinar and other programming that you might be interested in. I think you can use it in an interactive way. So if you have a question about something, feel free to visit us on social media, on Facebook and Instagram, and on our website. And I think links to those I've got at the end of our cruise. So when we deboard the boat, you'll be able to see those links. I don't know if any of you all got to check out the Brain Booster in this week's weekly MyAlliance newsletter. Those are pretty fun to put together. As you might have noticed from the title of today's presentation, Loeb, which is my last name, on brain lobes, which of course lobes are what we call individual sections on the brain. You may have heard Tina say that I have a bachelor's degree in English, which means I love words and I love language, and I have never met a pun I didn't like. And so you may see with some of our brain boosters some wordplay, which I think is good for our brains and good for us to think about new ways to approach the world and everything we can do to keep our brains excited and about possibilities of learning new information and staying healthy. So we'll watch out for those brain boosters. And so I hope you look forward to those every Monday, even if they're just like some really terrible puns. Whatever it is, they will be exciting for you to stretch your brain in some new ways, which we have some pretty good research that says that is a good thing to do to keep your brain active and healthy. From there, let's cruise on over to support groups. I think a lot of people know that KUADRC offers support groups, but not as many people know as probably should. And so we want you to know that there are groups available for people with a diagnosis, for care partners, for people who are caregivers of someone with a diagnosis. There are options for in-person or live meetings where you can be face-to-face with someone in a room, sort of like a traditional support groups were started that way, to meet in a room with other people who can say, yes, I've been there, I've done that, me too, I understand how you feel. And then we also have groups that meet virtually. And that was one of the silver linings of the pandemic. You know, nobody wished for COVID-19, but one of the really nice things, if you have to find something nice to have come out of a global catastrophe, is that COVID allowed people to meet in support groups in ways that they might not have thought of before. It allowed people to meet from other parts of the country and allowed people to share with their families what they were going through. Maybe the adult daughter who's the main caregiver for mom could say to her younger brother, join me in the support group and we can talk about what we need and what our questions are and how you can be supportive. So those are just a few examples of how support groups can be meaningful. And we encourage you to take a look at our website and find the support groups that might be a good time for you, a good fit for you in terms of date and location, Zoom or in person, and we'll be happy to take you on that ride. I'm going to swing back over to the LEAP program that I mentioned before. LEAP stands for Lifestyle Empowerment for Alzheimer's Prevention, and it has got some really excellent programs. I just mentioned a little bit the Mediterranean diet class that just started about a week ago. That's one of the questions that I have been asked throughout my career. You know, what kind of magic beans can I eat to not get Alzheimer's disease? Or what should I put into my body or not put into my body to make sure I don't get this? And let me tell you, I can probably speak for many of my colleagues here that if we could tell you absolutely the magic thing to eat, we could put ourselves out of business, right? We could say, oh, well, we don't need to do this work anymore. So we're working on it. But over the years, there's been lots of study, lots of education and research about food, because food is so culturally important, biologically important. It's meaningful to families. There are lots of reasons to focus on food. And one of the outcomes of some of that research has been that eating a Mediterranean diet can be protective of your brain, can be protective in terms of prevention, can be helpful even in terms of a diagnosis, and can give future generations some guidelines about what they like to enjoy. I can tell you that yesterday, the ADRC staff had an annual workshop. It was my first time getting to meet many of my new colleagues. And I had lots of things that I enjoyed about that workshop. And on that list are this wonderful lunch that we had. Now, I have not been to the LEAP class. I know it's about a Mediterranean diet. I kind of have a feeling that chicken shawarma and pita is maybe not on the Mediterranean diet, but I will give a high five to whoever picked that menu for our lunch yesterday because it was delicious. And I can tell you that if you participate in the Mediterranean diet class, they're going to do all kinds of lovely things, I'm sure, with fish and green leafy vegetables and olive oil. And I'm not going to say they have red wine because this is a university setting and a hospital, but I have heard that red wine can be conducive to good brain health. And if that's not true, then you didn't hear it from me. But if you're interested in learning about that LEAP program and the diet, I invite you to take a look at our website, get in touch with us and find out how you might be able to participate in that program. So I think we're at a pretty good speed. I think you measure cruise speed in knots. I have no idea how many knots we are sailing at, but I'm watching my clock and we have a few more minutes before we will be back at our docking station. So I want to give another shout out for the MyAlliance for Brain Health program. That means every Monday at about 7 o'clock, your inbox will chime. If you're not awake, then set it so it doesn't make any noise for you, but know that at 7 o'clock, you will have an email from MyAlliance talking about things like what the weekly webinar topic is for the week and what hot research might be happening and the brain booster and all kinds of wonderful things. And we'll be happy to make sure that that gets to you. That email also goes out in Spanish. That's another one of my, I was going to say hidden talents. It's not hidden. I am a bilingual person and I'm excited to be able to bring that skill to the ADRC. And so if you are in touch with someone who might appreciate receiving the MyAlliance newsletter in Spanish, know that that is available to at your fingertips. In a job that I had before I joined the ADRC, I learned enough Russian to be able to say, I don't speak Russian, and please and thank you. But one of the initiatives that the ADRC is super excited about is especially meeting the needs of audiences who come from diverse populations. And one of those needs we meet, of course, is having material available in accessible languages, thinking about diversity, equity, and inclusion. So I mention all of that to say we are not stopping at Alzheimer's disease only for people who can read a certain language. We have lots to learn about Alzheimer's disease, but one thing I think that we already know for sure is that it is no respecter of persons. All sorts of people get Alzheimer's disease, people of all races, men, women, all genders, people from every state in the United States and from all over the world. And one of our goals, excuse me, at the ADRC is to reach as many of those people as possible to either not get Alzheimer's disease in the first place or to be well equipped with as much information as they can have as they journey on through the disease. So MyAlliance for Brain Health is one way we can do that. And you can, when you sign up for MyAlliance, get information that is tailored to your role as someone who lives with and loves someone with Alzheimer's disease or another dementia, as well as information that is tailored to having the diagnosis yourself and more. So think of it as a really great tool for brain health. And remember those fun brain boosters, trivia questions, math problems, wordplay will be part of that weekly email. And then our final short excursion, I want to make sure you know about the Care Text and Cuida Text programs. These are exciting interventions that we have going. We live in a world that really has shifted from phone calls anymore to text messages, and busy caregivers are no exception to that. And so the Care Text and Cuida Text programs are interventions that the ADRC has set up so that you can get quick tips, advice, even something that might lead to a longer conversation with someone who knows what they're talking about in terms of Alzheimer's and caregiving and resources, just right from your phone. You don't have to talk to someone. I'm a Gen Xer. I think my generation might be the last generation that knows what a rotary phone is and, you know, a dial tone and actually pressing buttons on the phone. And the young folks that come after us grew up with cell phones and smartphones and texting. And so the Quita phone, or Quita text program is really exciting because it's just another way for anybody who has a cell phone. You don't have to be a young person, but anyone who has a cell phone who is dealing with Alzheimer's disease to get some support. I don't think there are any time restrictions on it. We know Alzheimer's doesn't care what time of the day it is. So if it's 2 o'clock in the morning, you feel the need to whip out your phone and send a text to someone, I think you can. I'm not sure they'll answer at 2 o'clock in the morning, but go ahead and put your question out there and know that someone on the other end will be available and happy to connect with you and give you the support that you need. So looking ahead, I can see that we are about 5 minutes away from the shoreline. I told you this was going to be the fastest cruise you ever went on. So I'm going to move to our slide that talks about souvenirs and support. And these are just a couple of links to and emails to the programs I talked about. You can go to kualzheimer.org to find information about all kinds of things that the ADRC does. If you want to send an email to someone here specifically about the MyAlliance program, that can go to MyAlliance at kumc.edu. If you go to the kualzheimer.org website, the much shorter URL there, you'll get to some links for the MyAlliance program. And then finally, there's me, Kelly G. I did not intend to rhyme that, but it worked out. Feel free to take down my email address and my phone number and send me an email if you have any questions, if you know any good jokes, if there's anything you thought you were going to hear from me today that we didn't get to. I would welcome being in touch with you. And with that, my clock says we have 3 minutes left. So if you've been sitting waiting for me to quit running my mouth so you can ask a question, the time is now and I will pay attention. So here we go.
All right. Does anyone have any questions for Kelly G? Thank you for that presentation, Kelly.
Thank you. I'm opening up the chat. I see, let's see, I see Yvonne says, great presentation. Thank you, Yvonne. Thank you, and I'll see you later. I did not ask Yvonne to say that, but I appreciate that. Thank you, Carol. It's good to meet you, and I hope you'll join us again. Thank you for taking the helm. Valerie gets me. Thank you, Valerie, for sailing with me. Someone on an iPhone says, what was the purpose of today's Zooming? iPhone, great question. My goal was to introduce myself to you and let you know that I will be here captaining the ship for the weekly webinar. So every Thursday at 2 o'clock Central, we'll be talking about something related to Alzheimer's disease and the research center and support that we can offer. Don't worry, it won't be all me all the time. I'll just be your friendly host, introducing someone who is truly an expert about whatever the topic is at hand. I think it's okay for me to say we welcome your suggestions or ideas for topics you'd like to know about that. So feel free to send us an email, give me a call, whatever you would like to do if you've got something that you really would like to learn about. And you're also welcome to say, I don't want to go on a cruise anymore. I will take that into consideration. So thank you for asking that question, iPhone user. And I hope that was a satisfying answer. Okay. Anything else?
Any other questions for Kelly? Well, Kelly, thank you so much for guiding us through the services that we offer here at the ADRC and talking to us a little bit about the ADRC and the things that we do here. And I love the cruise analogy that you gave for us today. And everyone, I want you to know that Kelly will be the person who will be hosting the webinars moving forward. So you'll get to see lots of Kelly. So we thought this was a great opportunity for you to get to meet her, know a little bit about her, and hear about our ADRC. So a few other things here as a reminder, we will have our weekly webinar presentation next Thursday at 2 o'clock again. Kelly G will be leading that for you. Look out for the information about the topic on your MyAlliance Monday email, or go to our website, kualzheimers.org. The presentation and recording will be available on our YouTube channel shortly, which you can find by navigating to our website under weekly webinars or by using the link in the reminder email. If you have any questions, feel free to email us at myalliance@kumc.edu. Oh, looks like there's a quick question in the chat about LEAP, who to contact about LEAP. So let me put some information about LEAP in there real quick. Or Kelly, do you want to talk about that? And I'll put.
Sure. My colleague, Rachel Sandoval, is the LEAP leader. And so should we put her email in the chat, Tina?
Yeah, I'll well, I've got our website, which you can go to.
Thank you.
That has all kinds of information about our LEAP program, and you can sign up for our upcoming classes. We have the Brain Health Boot Camp, and we have the Mediterranean Diet. Oh, you're registered for LEAP, but can never join the meeting. Okay, so let's get you in contact with Rachel.
Yeah, we'll make sure we get you to the right place. And I'm sorry, I didn't remember to mention the Brain Health Boot Camp, but I mean, the words boot camp probably give you at least a suggestion of what that might mean. Although I don't think anybody's going to yell at you or say, drop and give me 20 or anything like that.
No.
But it's a way to keep your brain active.
This is Cam McEwen, and I am on the Mediterranean diet seminar, and she has those all recorded, and you can catch up if you miss one.
Oh, excellent.
Thank you,
Cam.
You win the prize for today, which is a free cruise. Yay!
Thank you, Cam. And iPhone user who had the question about LEAP but can join the meeting, Rachel Sandoval is your contact, and I put her email in there as well. All right. Well, thank you, Kelly, for being our captain, and bon voyage, everyone.
Bon voyage, everyone. Have a great week. We'll see you next Thursday.
Thank you, Dr. Tina.
Thank you,
Kelly G. It was very creative. Really enjoyed it.
Thank you.
Glad to have you on board.
Thank you. Oh, I will stop this. Stop share. Okay.